Hello everyone. Here we are going to discuss an important topic, that is hyperemia and congestion. From hyperemia and congestion is more important. So we will see congestion in detail. We will see congestion in right heart failure as well as left heart failure. Basically, we will see the chronic venous congestion, that is CVC of three organs in detail. That is CVC lung, CVC liver and CVC spleen. We will be seeing the gross and microscopy of each of them. In your university exam, you usually get the short question on each of them. So let's start it. So you can see here we are starting the topic, that is hyperemia and congestion. So we will be seeing the congestion in detail, chronic venous congestion of lung, liver and spleen. So first of all, I will let you know the definitions of hyperemia and congestion. What is hyperemia? What is congestion? Tell me the definition of both of them, and then we will understand the differences between them. Then we will take the congestion in detail in right heart failure and in left heart failure. And then we will see the CVC of three organs, that is CVC lung, liver and spleen, the gross of each of them, the microscopy of each of them, the ultra important topic on which you usually get question in your university exams. So let's start with the definition of hyperemia and congestion. So what is hyperemia? What is congestion? Now look at the diagram. In this diagram, you can see here is the organ. You can see the artery is supplying oxygenated blood to this organ, pure blood to this organ, and the vein is carrying deoxygenated blood or impure blood away from the organ. Now imagine two things one by one. First of all, you imagine what happens if the artery got dilated. If there is vasodilation in the artery, what will happen? So this organ will get more blood. More of which blood? More of oxygenated blood, pure blood. So this organ will have increased blood in it, and that is oxygenated blood, and that's why the organ look red in color. That is organ is erythematous. So this is known as hyperemia, and it is due to vasodilation of the artery. Now imagine the second scenario. In the second scenario, imagine if the vein got obstructed. Artery is normal, but the vein got obstructed. So either there is a actual obstruction or there is a functional obstruction in the vein. So here the pure blood is coming, oxygenated blood is coming, but the deoxygenated blood is not draining away. It is accumulating in the organ only. So again, the blood will be more inside the organ, but this time the blood will be deoxygenated blood, impure blood. So the organ will look blue in color, which is known as cyanosis. So the organ will be cyanotic, and this is known as congestion. So I hope you all got it. What is hyperemia and congestion? So hyperemia as well as congestion, in both of them there is increased blood in the organ. Increased volume of blood inside any organ is hyperemia and congestion. Now which blood? If it is oxygenated blood and the organ look red in color, it is hyperemia. And if it is deoxygenated blood and the organ look blue in color, cyanotic in color, it is known as congestion. So that is the definition of hyperemia and congestion. Now for causing vasodilation of the artery, it's the active process. ATP is required. So hyperemia is an active process. But for obstructing vein, no energy, no ATP is required. So this one is passive process. So hyperemia is active and congestion is passive. So I hope you all got it. What is hyperemia and congestion? Hyperemia is due to dilatation of the artery, and congestion is due to obstruction of the vein. Hyperemia is active. Congestion is passive. In hyperemia, oxygenated blood accumulate in the organ. In congestion, deoxygenated blood accumulate in the organ. Here the organ look red in color. Here the organ look blue cyanotic in color. So that is the definition. So I hope you all got it. The differences as well as definition. So hyperemia and congestion, definition of both of them is same. It is increased volume of blood inside the organ. Increased volume of blood in an organ. The definition is common. Now see the differences. Hyperemia is due to dilatation of the artery, and it's the active process. And congestion is due to impaired venous drainage, obstruction of the vein, and it's a passive process. Here oxygenated blood is accumulating in the organ is red erythematous. Here deoxygenated blood is accumulating in the organ, so organ is blue and cyanotic. I hope you got it. Now we will see the congestion in detail. Now see, what do you mean by congestion? We will see congestion in two scenarios. Congestion in left heart failure and congestion in right heart failure. What do you mean by that? Now listen, when the heart is pumping, when the systole of the ventricle is taking place, so correspondingly the blood will flow. When the left ventricle is doing the systole, the blood go in the aorta and distribute all over the body. When the right ventricle is doing the systole, the blood goes in the pulmonary artery and goes to the lung for the purification. We all know that. Now imagine either there is a left heart failure or right heart failure. So either the left heart is not pumping properly or the right heart is not pumping properly. So what will happen? You tell me what will happen. Again, I am saying the same thing. Either the left heart is not doing the systole properly or the right heart is not doing